Hello and welcome to today's Mental Health University podcast. And I'm super excited today to have Dr. Kevin Chan with us, one of an amazing family practice doctor with an incredible amount of certifications and experience with a big practice in Arizona. And so, Dr. Chan, thank you so much for joining us today.
Thank you. Thank you for inviting me to talk.
Yes, and I know you're very busy. You have a very busy practice, and so I really, really appreciate the time you're spending here talking about, this new emerging health paradigm, what you're doing with your practice, and also about lifestyle prescriptions, how you integrate it into your practice. So I really appreciate it. But let me first introduce you so everybody knows, your expertise in this field. So you have. You've been an osteopathic doctor, medicine, have a family practice. You have so many degrees basically in integrative medicine, anti-aging, regenerative medicine, East Asian, the original Chinese medicine practices, integrative lifestyle medicine. So you're very, very experienced and have a practice for many, many years, right? So you want to share a little bit your story in a sense that how you started and where you are right now in terms of your practice.
Wow, that's a very, very open-ended question. Okay, so again, I'm not going to waste your time or everyone's time on my credentials, right? I mean, anyone who's interested, can go to my website and look at my credential. The key point is, yes, you're right. I started out as a family physician. Then I spent some time doing more training in preventive medicine. And so, now basically I specialize in preventing what? Preventing heart disease. Why? Because that's it remains the number one killer in the world, right? Followed by cancer, although cancer is catching up quickly. So as a preventive physician, right, and I found that, if you really want to prevent, as you know, going back to conventional medicine, preventive medicine is really nothing more than just early detection. Right, early detection of breast cancer and early detection of prostate cancer, and early detection is important, but is not enough. If you really want to prevent something from happening, then you have to go beyond just conventional medicine, right? You have to really go into integrative and more holistic medicine, and so that's how I got involved more, right? From primary care to preventive medicine, and then from general preventive medicine, then I say, you know what? I really need to know more preventing, not just detecting early, right? Detecting is good, but not enough. So then I step more deeper into integrative medicine, pretty much since 2003, right? So until now, and so within that territory, right, I subsequently got exposed more and more to the different types of integrative medicine, holistic medicine, and like you mentioned, right, Chinese medicine, especially the classical style, more than the contemporary TCM style. And that's the time I also spent on doing more acupuncture, and then from there, I also get very, very involved in hormone therapy. So when we talk about, okay, so Dr. Chan, so let's talk about how do you really prevent heart disease, right? And of course, right, lifestyle, nutrition becomes very important, but my take is in addition to lifestyle and nutrition, right, and mind. Typically, my patient, right, as it, when I say, well, as we get older, everything tends to be better except one thing. Oh, my health begin to deteriorate. So when everything is moving in the right direction, but my health now is moving in the wrong direction. So all I do, I tell my patient that, you know what, that's all I do is I'm attempting to move your health direction to align with the rest of your life.
Very well said. Very well said.
In that good direction, that's all I do.
Yes.
That's what doctors should do, right? All I'm doing is I'm trying to realign your health direction to the rest of your life, which is getting better and better as you evolve. right?
Right, exactly. And you mentioned something at the beginning that it is all about prevention and also knowing what the root cause is, right? And this is something obviously that we here at the MedHealth University and especially with lifestyle prescriptions, we focus on heavily on this root cause diagnosis and knowing really what the trigger is, what from a biopsychosocial perspective. So can you talk about that? How you integrate that into your practice?
Good. First, let me tell you this. In conventional medicine and even in holistic medicine, right? I mean, I've been getting my training from, pretty much every place I can get integrative training, I will participate. And I realized one thing, right? We are all very good, whether or not we are dealing with conventional medicine or integrative medicine, we are very good at explaining things mechanistically. Right, we are very good at how, right? I mean, you can go to very conventional conference, or even some of the more integrative, right, functional medicine conference, right? And we can focus so much on how things happen. How, right? We are so into biochemistry, nutritional biochemistry, and even if you go into energy medicine, then we can also talk about the energetics. But still, even when you're explaining things, in advanced nutritional biochemistry or, an bioenergetic medicine, we're still talking about how things happen mechanistically. Right? I mean, the conventional model, which is very reductionistic and very material, is limited. Okay, then we talk about integrative medicine, which is more broad, which is good, right? Explain things better, right? In a broader perspective, but still, is how things happen mechanistically. I can tell my patient in very detail how your cancer developed or how your heart disease developed. But you know what? Through mental health training, though, I realized I can start to talk about why. Why? Not just how, right? In conventional medicine and including many integrative medicine, I can speak very well how. Right, I can throw in Chinese medicine terms, right? I can talk about your qi and blood, right, and yin and yang, and still, it's how. Thank you very much, Dr. Chen, for telling me how, right, how it happened. But why? Why? Oh, I don't know why. I don't know why. Maybe it's your genes. Maybe it's just by chance. I don't know why. So the point I want to bring to you, Johannes, is when I use mental health analysis for my patient, for the first time, I was able to give them some glimpse of maybe why it happened, right? Especially from a psychosocial, emotional point of view, right? I can say, right, because of your childhood trauma, or go back to the Uden moment, or whatever trigger that you have in your life, that could be why. Right, and then that may be the why, and then all the biology and biochemistry and the biophysics that we know in medicine can explain how it happened. So I hope that explained to you why I found mental health analysis so beautiful and so important, because for me is a missing part that I can explain so well, right, to my patient how it happened, but I can never really explain why. Now, of course, you can still add into maybe chance, and you could be God, you could be the universe, but mental health analysis give me more information. Like I said earlier, give me a snapshot of maybe why it happened. So the way I integrate in my practice is again, in my busy practice, I quickly, whenever a patient have a specific diagnosis or symptom, and for those who are interested and asking me why, I said, you know what? I don't know why it happened, even though I can explain to you how it happened. But let me pull down my charts, right, from you guys, from mental health, and let me look at a chart, and let me see if I can make some sense out of that for you. So oftentimes when I see a patient who is really trying to, but why? Why it happened to me? Why? Why now? Why not before? Why not yeah, tomorrow, but why now? And I was like, you know what? Let me pull the chart. Let's talk about your symptoms. And then first of all, I'll ask him, please clap your hands. Let me find out what is your dominant side. Are you right wired or left wired? And I go from there. And then I immediately talks about, okay, so depending on which hand are you wired, then your right side or versus your left side may represent your paternal or your maternal side and things like that, right? And then I start to talk about how the different conflicts, right? Make them aware, like you said in your lectures, different conflicts, emotional conflict that make them aware that could be a trigger of this event. And then I talk about the timeline, right? The two phases, and say the stress phase, and then the regenerative phase, and then the approximate timeline, and attempt to explain to them, hey, right, does that make sense to you? And 9 times out of, I would say 10 times out of 10 times, they are in awe. All my patients are in awe. They're like, wow. Are you kidding me?
Why is that? Are they in awe because they
I
start to
think
realize the connection between their life experiences and emotions and their physical symptoms?
Yeah, because I have to say I'm lucky enough that I started my mental health training with a different organization back then, starting in 2010, something like that. So, and I don't know, but I think I still remain one of the few, if not the only one, certified mental health coach or provider in Arizona, right? So when I talk about this, and people are like, oh my God, I have never heard that before, right? Including the one I talked to you yesterday, right? I saw a patient yesterday who came to me and said, Dr. Chen, thank you so much for treating my acupuncture, because I do the advanced classical acupuncture, which is called the balance method by my late master, who just passed away maybe a year ago. Anyway, so yeah, I was able to treat the pain easily right away. But the problem is the pain keep coming back.
Right.
And my patient asked, hey, Dr. Chen, why is my neck pain, right, keep coming back? My neck and shoulder pain. I can treat that easily every time. But why do they keep coming back? I did not do anything to trigger that, right? I was asking, did you hurt your neck? Did you hurt your shoulder? Did you do anything, that might trigger that? Were you lifting something heavy? And said, no, I didn't do anything. I was just doing something regular. Then I said, you know what? Let me ask you that. How about, let me I said, come to my office, sit down. I said, let me pull down my mental health charts. Okay, let's talk about that, right? Show me your hands, right? Again, are you right hand, left wired? So yesterday, she was left wired, so she had pain on the right side, right? And then, neck problems, so I immediately go into musculoskeletal issues, something to do with self-evaluation, your shoulder, like something, with your burden, neck, intellectual issues, and then the pain sometimes can go to mid-back. I was like, feeling humiliated. And so I was trying to get there, and so she was like, oh my God. And I said, could those be the trigger that is triggering your pain? Right? And so, and then to answer your question, Johannes, to continue to integrate is, I said, well, I'm not a therapist, right? So I don't have the time and nor the patience to sit down with my patient for 2 hours. But then here's what I offer them. I said, if I am able to give you some idea of what could be a potential cause from a psychosocial emotional point of view, and I would say, you know what, let me send you to our therapist, right? But then again, the problem with therapy in general nowadays is, well, what am I treating for? Depression, right? Okay, general. So it becomes so broad that it's hard to, my patient under stress. So the stress is causing her to be depressed. So go to see my therapist. Bye. Right? And it's not very specific. So I think one good thing that mental health allows me to have is be able to precisely, or perhaps more precisely, tell my patient that, like yesterday, I said, okay, to maybe, right, to help you to decrease the recurrence of your neck pain, besides doing the usual thing, right, besides, seeing my physical therapist and coming for acupuncture, but let me consider, right, have you considered seeing a therapist, and let me be more specific about what issues that you might be working on, right? Those issues should revolve not just about stress in general, but it should be more focused on, for example, self-devaluation issue, right? Something that you feel like that you're not enough about, right? Especially intellectual issue or burden, right? Having to take care of your family as a burden, and right, something that makes you feel like you are, feel like oh my God, I forgot already. Feeling humiliated, right? By the situation, and I think those should be the issue that the therapist should work with you on, to make these sessions more efficient and more effective, right? Than just, well, I'm coming here because I don't feel good. I'm not happy. I'm stressed. I'm depressed. So fix me, right? That's more challenging, right? But if I can help my patients to be more specific, I believe even then when they see a therapist, it will be much more efficient and effective.
And that's exactly what we experience again and again. And I think that is what we, especially you talk about the meta health analysis part, which is a big part of the lifestyle prescription process that we offer, that we use now. Because we found exactly what you said. Once a client makes the connection between their life, their emotions, their stressors, the stress triggers they have, even their thoughts and specific organ tissue, it's just so revealing. And then I really like what you said, even if you send them to someone else that is part of your network, because you might not work this way, right? Or have just don't have the time, it's just something they can work on very specifically. It's not just a general treatment, but very specific on that issue. But let me ask you this, because I'm very curious about that. First of all, it's great to hear that, when you use our lifestyle prescription charts, and obviously how to read them, how to work with them, and feed that information back, like their conflicts and their emotions, that they say, wow, this is really something. First of all, it's so new that somebody actually addresses the why. Why is this happening? Why do we have chronic issues that appear again and again? But my question is what you mentioned about the healthcare system, right? That as a doctor, you don't have just a lot of time, which is a big challenge. And so that is part of the lifestyle prescription process, where we want to make it so easy for everyone. It doesn't matter if you're a medical doctor that has maybe just a couple of minutes, 5-10 minutes, or someone that has more time working with clients, to use this new root cause based diagnosis and solution system. So talk a little bit about that, in terms of healthcare, how much time you have and how actually you do it to integrate it in a short period of time.
Sure. One of the beauty of mental health and lifestyle prescription is I think is so empowering is the awareness that I create for my patients. Now that I don't have to take too much time to do that. Sometimes I can just quickly talk about it, like rash, right? Rash, eczema, right? Oh, well, it may have something to do with separation anxiety issues, right? And I just quickly takes me 1 to 2 minutes, and then that is enough to make the patient aware. That's all I want. So for the majority of my patients, right, who may not be ready to go deep into mental health, just making them aware of a possible connection, that is enough, right? When I have eczema, and I would say, you may food allergies and all that, and leaky gut syndrome, we have to deal with that. But it may also be, an issue with separation anxiety of your child, and that is enough to make them be, really, wow, right? So now, for those patients whom I'm seeing for more time, right, I do have a separate, smaller practice that allows me to spend patient more time with. Then yes, then I can go deeper. I can go deeper into the analysis, and I may be able to do even some simple therapy, right, or what we call simple health coaching, right, if my time allows. But the majority of my patients, all we have to do is a quick, 1-minute diagnosis to make them be aware. That's enough for them to like really, and to get them start to think, right? And then when they come back, then we can talk more. So I think that is for me, is one distinguishing factor that that again distinguish me from other providers, because no one else does that.
Yeah, and
in my
really
area.
answering the question. I mean, I think a part of that is that that's what people really want. I mean, if I have a health issue, I want to know why. And we, as you said, we never address that, and it's such an empowering feeling that I know the connection, right?
But the problem is conventional doctors, myself included, right, don't know the answer. I don't know. I don't know
Mm.
why. I don't know why. I don't know. Blame your parents, right? So it, right, maybe you have bad karma, from your past life. I don't know, right? So, but like I said, at least in medicine, no matter health or lifestyle prescription nowadays, I have a glimpse, right? You give a patient a taste of what might be the reason, what might be the root cause from a psychosocial emotional point of view, which I think is so much missing, right? Even when you go into conventional mind-body work, right? What do? Still, they focus on therapies, right? Oh, let's do mindfulness. Let's do meditation. Let's do, whatever that stress-based, management and EFTs, different, you name it. But they don't address why. So I fall in love with mental health since 2010, because this is the only system that I know of that really give me an idea of why things happen from a psychosocial emotional point of view, which I think is brilliant and very elegant when you can link, right, the conflicts, the emotions with embryology, right, with the brain, and then from the brain relay to the organ systems. It's beautiful.
Right. And I think, what makes it so powerful is that people just know deep down that this is actually the case. These stresses they have in their lives, that they actually do affect them physically, and that is what we call really this lifestyle prescription: root cause, diagnosis, and solutions. Right. Once we know what specifically is triggering a certain process, if we, like with the faucet, right, we turn off the faucet instead of letting the water run and try to fix the water, the puddle on the floor. Yeah. And so if you know specifically what that faucet is, then therapy becomes very targeted.
Yeah. So to me, this is the integral part of my practice. Is if you really want to treat the patient holistically, right? Then yes, I'll right. This is how I tell my patients. I use conventional medicine to engage you, right? You come to me, especially through your insurance, right? I engage you with conventional Western medicine. But if you really want to win the battle, right, and score successfully, then I would use integrative medicine to make you better. But how do I use integrated medicine? Well, of course, right, using whatever I said earlier, hormones and nutrition. But I think, within the mind-body aspect, meta health analysis really allows me to do a more precise job. Precision, right? Now, precision, when we talk about precision medicine, which is, I also talk about that in my video on my website, like I told you earlier. Right. But precision, we imply, genetic precision, right? A nutritional precision, how we can target that disease to a gene or a disease to a receptor, right? But when I say precision, in this case, it's also psychosocial emotional precision, right? How you can precisely talk about a particular issue that might be the cause, right, of your condition, and I can send you to the respective therapist or hypnotist or whatever that resonate with you to get that clear or unblocked or treated, right? And that, to me, that is another level of precision. Precision is not just limited to nutritional use or hormones or genes, right? Which is not really discussed in other form of integrative medicine. They don't talk enough about that.
Right. And I think, what's happening which you probably have seen many times. Once we change the conditions basically where a client lives, that is specifically to the health issues, as you say, to the eczema, it's the separation anxiety that somebody disappeared out of their life, separation, death, or whatever it is, these traumas that people experience. We start to shift that, and the body heals naturally, automatically, which then on the biochemistry level, basically you start to see these regeneration processes. So
yes.
And you basically use then all the modalities that you have to support this process, right?
Exactly. So good point. So then as the body begins to perhaps heal itself, then I use the rest of the modalities to support. Right. So in a way, I tell my patient that I can shorten your face, right? Make it shorter so that you can recover sooner. That's all we are doing.
Wonderful. I really appreciate that sharing this here. Now, can we talk a little bit about the healthcare system and other practitioners? Because obviously what we specifically want, at the Lifestyle Prescription Foundation and the MedHealth University is that this is really getting out there to a lot of the family doctors, the physicians all over the world to integrate lifestyle prescriptions, because I believe that we can really create a completely different set of healthcare systems just by this little switch, this little addition, not just RX prescriptions, but lifestyle prescriptions. Can you talk about that, how you can see that from your perspective?
Yeah, because I keep talking about this myself, that I said true healthcare reform, right, is not based on politics. Is, to me, in my opinion, is not based on the president. Right? It's not based on what care you're going to get. It's really based on both the doctors and the patient's mindset of what health really is to them. So to me, right, if you ask what type of doctor I am, sometimes I would say, well, I am just a doctor that loves to change mindset. Just like back then, several hundred years ago, right, when we first talk about Earth is round and you think the Earth is flat, that's all I'm doing now. I am simply trying to educate patients that, no, our Earth is actually round when you think it's flat. So I am doing that in the healthcare arena. So to me, this is the paradigm shift. The paradigm shift is really not just about knowing more biochemistry and knowing more biophysics, right? Really, the paradigm shift has to do with the mindset. And with that mindset, right, it includes the understanding, right, that, oh, wow, many of the root cause problem has to be with the psychosocial emotional issues. So I think that, to me, is a major paradigm shift within healthcare system. And right, not just nutrition. Most doctors now would say, yeah, maybe we should do more nutrition, lifestyle, right? If you go to the basic lifestyle prescription or lifestyle discussion with patient, right, exercise and diet, and this is the problem I encounter too with typical health coaches nowadays, right? Within our system, what do they really do? Well, most of them only focus on nutrition. Right, you can go to it. Most of them, right? In fact, many health coaches were trained as some type of a nutritionist or a personal trainer, right? So they are extremely good at discussing with my patients about their nutrition and about what exercise they want to do. But the problem is, do they really do them? Do they really follow the direction? They don't, right? You can, in fact, many patients will come back and tell me, Dr. Chan, thank you for sending me to those nutritionists and personal trainer and exercise physiologists. You know what? I know those things. I know them. I can just grab a book from the bookstore and I read about it. And So let me tell you this, right, Johannes. The problem we have in our system right now is not information. We have enough information. We know what we need to do. The problem is people don't know how, right, like why, right? They're not, they have a behavioral issue that we need to change so that they can follow through. So we do not have a deficiency of information on nutrition or exercise, but we do need more help to motivate, right, patients or people, right, and make effective behavioral change. And one way I believe and I found, right, that to be true. One way to make my patient to be more proactive and are willing to follow through the nutritional and exercise recommendation is to make them be aware of the cause, right? If they are more, like you said in your lectures, if they are more aware with the psychosocial, emotional basis of their condition, they're much more likely to follow through your lifestyle recommendations by physicians or by the nutritionist or by the exercise personal trainer.
Yeah, and I totally agree with you, because we've seen this again and again, and it's even in my own life, right? I mean, it is difficult to change lifestyle, nutrition and exercise, and we have such busy lives. We are overloaded
or
with
like you said, or yoga, right?
Or
yoga is your
right?
thing.
Exactly.
Right? So Tai Chi is my thing. But
yeah,
it doesn't matter,
is difficult,
right?
I
tell my patient,
knowing basically when clients know what is the root cause, I think they are, first of all, they're aware, they can be specific in the changes they make, sometimes a little tiny change in their lives that, let's say, is connected to the separation or to certain anger issues that they might have.
Yes, and they're much more likely to change.
Exactly.
That, so at the essence of this is, sometimes I would tell my patient that, it doesn't really matter. I mean, yes, I can pull all the evidence out there and say which diet is probably the most, right? I know you are a big fan of the Danish, Danish protocol, and but that's okay. There are thousands of nutritional therapies out there,
exactly.
and there are thousands of
totally
exercise,
agree.
right? Yeah, you can promote yoga, and I can promote Tai Chi, and someone else can promote whatever exercise they like. But the key is not, to me, so much on, oh, please, Dr. Chen, tell me the best nutrition that I should follow, the exercise I should do. And I'll tell my patient, that's not important. What is important is you actually going to do it. Right? It doesn't matter what I tell you, the best nutritional therapy you should follow, right? We can do different analysis. You can do functional nutrition analysis. You can do metabolic typing, blood typing, and all that. Again, are you going to follow it? Are you going to follow through? Right? What do I need to do so that you can become motivated to do it? Is much more important than what you're going to do. Is much more important than the specific type of therapies or nutrition or exercise. That what is important is that you are motivated to actually do it. And like I said earlier, one way for me to motivate my patient in 1 minute, because I don't have time to talk to them for an hour to motivate them, right? Is make them aware of that connection. And oftentimes, in 1 minute, when I make them aware of that connection, they are more likely to follow through.
Yeah, I've seen this again and again. Now, let me ask you something, because that seems to be a drive, especially in the UK and other countries, US too, that in the healthcare system there. Like, it's been known or realized that we need health coaches that basically help with that support, like with the follow through, with the compliance. Now, I kind of totally believe in that, but I also believe that when with health coaches, when they work more closely with medical doctors, for example, like you said in your case, you send them to a health coach or to a therapist. I think a big part is that they know the root cause, because if we stay general, right, or just change nutrition, just exercise, I think that is not really having a benefit. And then all the energy, that motivation that they have to change the clients, then it might lose it because they don't see the why really.
Yeah, I totally agree, 100%. Because I love health coaches. I love them. However, I think the contemporary training of health coaches in most organizations is not adequate. Right? Most health coaches, myself included, right? I went through several health coaches training just for the fun of it. Right, focuses on what? Motivational interviewing. And I got that. It's important. But I think if I can just add, right, an extra dimension of meta health analysis onto the motivational interviewing that we are doing, then once again, I believe it can be more efficient and more effective. And therefore, the health coaching experience will be better. I am very much looking forward to having more training with you, Johannes, on your lifestyle prescription health coaching program, because those are the health coach I want to hire, seriously, because I don't need to hire a health coach who just talk about nutrition or exercise. Come on, I can do that. If I don't know enough, I read the book, right? And then I can talk to my patient. They're not going to do it until you have some reason to make them change from a behavioral point of view, right? So, and motivational interviewing is important, yes, right? And also basic psycho therapy is important. I got that. But once again, with what you are doing, I think is going to make it even better.
Thank you. Really appreciate that. And I know we're way over time already, but it's so interesting.
Are we?
To listen.
I have so much fun.
That's all good. I think people are really going to like, health professionals and clients the same, listening to you talk from a, practical experience, having a big practice and 20, 30 years of experience. And so I really appreciate that. And thank you for sharing it, not just, how you work, but also how you see where healthcare can go and how you really, with the core, I think we all are very passionate about helping clients. And I think there's so much improvement possible.
Yeah, because I feel so. I mean, I hope I answered your question too, Johannes. I hope I'm useful to you and also to the world, right? In this healthcare reform, because I really believe we need healthcare reform. But healthcare reform is not going to be done by politicians. It has to be done at the grassroots level, right, with our patients and doctors, right, together, right, to change healthcare for the future. And I over the years, I feel like doctors, especially conventional doctors in the U.S., we have become, like I told you on the phone before, right? I feel like when I first became a doctor, I said, I want to, most doctors said I would help people, right? I want to be your primary care provider. But oftentimes, nowadays, we became nothing but primary drug pushers. Right? I said, drugs are important. Don't get me wrong. I'm not saying drugs are bad. But if we only do medications, that is, I believe we are doing our patients a big disservice. Right? So I want to go back to why I become a doctor. Right? Go back from being a primary drug pusher now. I want to go back to a primary care provider, a real primary care provider. Therefore, I need to know more about nutrition, exercise, lifestyle medicine, and especially mental health analysis.
Well, thank you so much, Dr. Jan. Really, really appreciate it. I know we could go on and maybe we schedule another podcast at some point. And so thank you so much. Your website is down on this page, or on YouTube, wherever people watch this video or this audio. So thank you so much. Appreciate it. And I love your passion.
Thank you. So can I give me how can I get a copy of your podcast?
I'll give you the file. I can send you the file, or actually, let me stop this here. Hold on, let me stop it. So,
health coaches, myself included, right? I went through several health coaches training just for the fun of it, right? Focuses on what? Motivational interviewing. And I got that. It's important. But I think if I can just add, right, an extra dimension of mental health analysis onto the motivational interviewing that we are doing, then once again, I believe it can be more efficient and more effective. And therefore, the health coaching experience will be better. I am very much looking forward to having more training with you, Johannes, on your lifestyle prescription health coaching program, because those are the health coach I want to hire, seriously. Because I don't need to hire a health coach who just talk about nutrition or exercise. Come on, I can do that. If I don't know enough, I read the book, right? And then I can talk to my patient. They're not going to do it until you have some reason to make them change from a behavioral point of view, right? So, and motivational interviewing is important, yes, right? And also basic psycho therapy is important. I got that. But once again, with what you are doing, I think it's going to make it even better.
Thank you. Really appreciate that. And I know we way over time already, but it's so interesting.
Are we?
To listen.
I have so much fun.
Good. That's all good. I think people are really going to like, health professionals and clients the same, listening to you talk from a, practical experience, having a big practice and 20, 30 years of experience. And so I really appreciate that. And thank you for sharing it, not just, how you work, but also how you see where healthcare can go and how you really, with the core, I think we all are very passionate about helping clients. And I think there's so much improvement possible.
Yeah, because I feel so. I mean, I hope I answered your question too, Johannes. I hope I'm useful to you and also to the world, right? In this healthcare reform, because I really believe we need healthcare reform. But healthcare reform is not going to be done by politicians. It has to be done at the grassroots level, right, with our patients and doctors, right, together, right, to change healthcare for the future. And I over the years, I feel like doctors, especially conventional doctors in the U.S., we have become, like I told you on the phone before, right? I feel like when I first become a doctor, I said, I want to, most doctors said I would help people, right? I want to be your primary care provider. But oftentimes, nowadays, we became nothing but primary drug pushers. Right? I said, drugs are important. Don't get me wrong. I'm not saying drugs are bad. But if we only do medications, that is, I believe we're doing our patients a big disservice. Right? So I want to go back to why I've become a doctor. Right? Go back from being a primary drug pusher now. I want to go back to a primary care provider, a real primary care provider. Therefore, I need to know more about nutrition, exercise, lifestyle medicine, and especially mental health analysis.
Well, thank you so much, Dr. Jan. Really, really appreciate it. I know we could go on and maybe we schedule another podcast at some point. And so thank you so much. Your website is down on this page, or on YouTube, wherever people watch this video or this audio. So thank you so much. Appreciate it. And I love your passion.
Thank you.